Good afternoon, everybody. We're going to go ahead and get started in just a couple more minutes while other people continue to log in. Thank you. Good afternoon and welcome everybody to today's webinar on how can EHR help with tobacco cessation. Last fall we were asked by the American Lung Association to present this topic to a group of their stakeholders, and after that we thought it was a great information for you all to know. So thanks for joining us today. My name is Monique Dever and I'm today's moderator. There we go. Today's presenter is Sonali Luniya. Sonali is co-founder of Patagonia Health and the VP of Customer Experience. She has a brilliant mind when it comes to using EHR technology to help meet the goals of healthcare agencies all around the nation. Before we begin the presentation, I have a few housekeeping details to run through. First of all, you will all be in mute mode during the presentation, so to keep in contact with us during the presentation, if you have questions, you can go ahead and put those in the chat box. That dialog box can shrink and expand with that red arrow up in the left-hand side there. So I think that's all I have to say. We will cover all the questions and answers at the end of the presentation, but go ahead and chat them in as soon as you have them, and then we'll cover the answers as we get there. So without further ado, I'm going to go over and change the presenter to Sonali. And bear with us just one moment while we change the screen. Okay. Great.
All right, good. And thank you, Monique. All right. Good afternoon, all. Today, I'm going to present to you or share with you my experience with EHR for tobacco cessation. The material that is presented in today's session is mostly related to Patagonia Health EHR, but the tips and tricks that I'm going to share is definitely not restricted to Patagonia Health EHR. You can build the same functionality in other EHRs as well. So a brief introduction about Patagonia Health. Patagonia Health is an easy-to-use web-based electronic health record system, which is focused on public health departments, mental health agencies or behavioral health agencies, and FQHCs. We have several organizations with whom we have worked on tobacco cessation services, and the material that I'm going to present is some of the findings we have from those organizations. As we all know, tobacco use and smoking are one of the leading causes of avoidable death in the United States. Tobacco use and smoking puts the individual at higher risk of other comorbidities. With 15% of adults in the country who are smokers and are at risk of other comorbidities, it costs the United States billions of dollars if you have a lot of smokers out there. 70% of the smokers want to quit, but they do need help. Most of them are successful with quitting if they are provided assistance with their clinicians. And the clinicians need help as well, so that's where the EHRs come in. So this is what I'm going to talk about today. Since EHRs are so prevalent these days, it can be a tool which can help you with your tobacco cessation goals. What would you like to have in an EHR so that you can meet your tobacco cessation programs or guidelines or goals? The first thing you want to look in an EHR, it should be easy to use. that EHR should be an asset and not a burden. It should be assisting the clinicians and not getting in their way to do their daily job. So it should be fast moving. When we say fast moving, what that also means it should do a lot of things, which is first thing is they should be able to document their work, but at the same time not have to click so many screens or go through X number of screens just to finish their work. That could become a hindrance. Also, when they are documenting their work, their templates should be set up in such a way that the data that they capture is available for reporting, and they can also follow up on their data, which is a part of their workflow as well. So documenting smoking status on the patient, which is a meaningful use requirement, they shouldn't have to go to some other screen just to document the smoking status. That is something more of a hindrance where they have to go to another screen, just document smoking status and come back to their clinical template and go over the rest of the material. That's what we mean when it should be easy to use. They should be on the same screen, and within the same workflow, they should be able to complete what their smoking cessation documentation. So for example, one of the common things many clinicians would like to do is if they are going to document smoking status, they want to gather that information when they are capturing social history while they are in the client's chart. Social history also includes alcohol consumption, exercise, etc. So while I'm doing that, I might as well be able to document my smoking status of the client as well. Now, smoking cessation, we do know, is done in several different types of appointments or several different types of visits at the health departments or behavioral health agencies. And it can be done, for example, in a prenatal care environment, or it can be done in a family planning visit, or it can be done as a special program if you are in a behavioral health agency or a mental health environment. There are popular tools which can be used. So cessation counseling, 5 ways is a very popular one. And to make it easy, the 5 ways tool should be, again, within the workflow. If it is on some other screen, which is not within my clinical documentation workflow, then it's more than likely that the clinician is not going to actually document what they did. They probably may go over the 5 ways questionnaire, but they may just not document in the system, which means now you don't have data and reporting capabilities from the 5 ways counseling that was provided. So in this session, I will show you some examples of how these templates can be set up. That's what is on the next slide. Now, once the counseling is done, there are follow-up activities. So the rest of the presentation, after I show you the templates, is going to show you how you can do these follow-up activities of report generation, sending reminders, the GIS mapping to see your community outreach. And in the end, I'm going to cover off how you could get paid and what are the common reimbursement service codes, which we find a lot of organizations are not aware of what service codes can be used for your smoking cessation counseling services. So for the templates, which we talk about should be data reporting capable, which means any information that I am documenting about smoking cessation. For example, let's say a 5 ways template. What you see on the screen is the 5 ways template, which is in Patagonia Health. All the information is captured either in a drop-down or in a checkbox or in a radio button. Now, by having this information captured in drop-down, checkbox, or radio buttons, this information becomes reportable. If I just put in a free text box, so for example, at the very top left where you see 2 cigarettes, if I didn't have that as a drop-down, and I had that as a text box, I could document that as number 2. Somebody else may put that as 2.0, or somebody else may actually spell out TWO. That becomes a free text box. When I export this data, I'm going to get this information in several different formats, how it was entered. Now I have to go back and massage all this information, clean it all out before I can actually see how many average cigarettes per day are my population consuming. So by having these drop-downs and checkboxes, it makes the data reportable. So once you export this data out, you can easily slice and dice it several different ways. You can sum them all up and average them out across your patient population. The next screen talks about how this can be within your workflow. So this is completely based on user feedback. Our users have asked us to put the smoking question, as in what is the current status of your smoking in the social history area, because that's when they are also talking about other items about their social history, which is alcohol, exercise, caffeine, etc. By having that available right there on that screen, the likelihood that they are going to capture this information, even though if you were not providing smoking cessation counseling, but once you have this information, you can run reports to see what is the current status of your smoking, of your population, and then you can identify if there is a need for you to have a smoking cessation counseling service in your organization. By having this within the workflow and easily available within that screen, they are definitely going to capture this information and also meet your meaningful use requirements, which requires that you capture your smoking status of your clients. Now, by having the data again in a format which can be captured and reported on, so let's say you are doing counseling services and set up goals for a client that he or she is going to reduce smoking to 2 packs a day. So once I set up that goal, every time when I do this counseling service, maybe once a month, I'm going to ask the client, okay, where are you with this goal? And I can update that status. Once I update the status over a period of time, I can see what progress the client is making towards that goal. So this shows me a graph of how the client progressed. Maybe the client actually did make some progress and then eventually they regressed. That is, there was a lapse in the smoking cessation and then they moved on again and now they've made significant progress. So that's what we mean by having this data reportable and in a format where you can take it and plot and graph it so that you can easily identify how your clients are doing with your smoking cessation counseling services. Now, during the counseling process, many clinicians refer the client to a quit line. These referrals in many places are sent via fax or paper or over the phone, which means the clinician has to print the paper, get out of the EMR, and send it over to either the fax machine or pick up the phone and call somebody. So this is, again, a diversion in their workflow. So what the clinicians will do is they may not do it themselves, they'll leave it up to the staff to perform the step. With technology, we can change this. The referral with the client information, this can be sent over to the quit line using electronic transactions. So it can be sent electronically as well. There are standard protocols for health information exchange. HL7 is one of them. I'm sure many of you are familiar with that. The referral to the quit line can be sent electronically using the standard protocol of HL7. What that means, a CCD with the client information can be sent to the quit line electronically. These standards are defined by the North American Quit Line Consortium. Now, by this way, you can actually do away with all the paper transmission that you are doing, do away with the fax. You don't have to pick up the phone and call the quit line that you're sending them a referral. You can directly send this from the EHR by clicking a button, create the CCD, and send this over to the quit line. Also, some of these quit lines are actually bidirectional. So the quit line will send this information back into the EHR, which lets you know what is the status of the progress the client has made towards their smoking cessation activities. So we are currently actually working with a couple of organizations where we are building this electronic referral HL7 via HL7 to the quit line in their state. Now, after I have done my cessation counseling and I have set up a plan, I have set up some goals that they are going to quit by a certain date, and I'm continuously following up with the patient. Now, how do I do the follow-up? How do I know how many clients do I have where a follow-up is needed? By documenting this information in my chart in reportable fields, I can run a report. Let's say I run a report of all my 5As that I have performed. Give me the list of clients where a 5As was done, and how many cigarettes did they have per week, and what was the quit date they had set. So now I have these list of clients, and by the quit date, I can sort out which are the quit dates that are coming up, and I can follow up with these clients to see how they are doing. This reporting information comes out with the various other demographical information of race, gender, ethnicity, etc. So in case you had funding or grants that you want to send reports to of your patient demographics, this can come out in that report as well. Okay. Now I have this follow-up report. What do I do next? Well, the easy thing is to pick up the phone and call the client and find out how they're doing. Another way to do this is I can automate that step as well by sending out messages directly from the EHR by text messages to the client to find out how they're doing on their smoking, do they need help, or do they want to set up a time to discuss this. That's what you see on the left, where I have sent out a message to this client called Macy Jane, and I have a message written up trying to find out how she's doing on her smoking, and if she wants to set up a time to discuss this. That's one way you can send this information out. Another way also is you can send out email messages directly from the EHR, and you can customize the email message. If you know this client needs some help and you find an interesting video that you want to send out to all your client population who are working towards quitting smoking, you can craft an email and then blast this email out directly from the system. We have some of our clients who are using this where they actually send out bulk messages to certain type of clients so that they can remind them of their activities or also remind them of what goals they had set up for themselves. Now, beyond that, at an organization level, I want to do some planning I want to see where are my clients really coming from. So I can see this through a tool which is integrated into the EHR, where I can actually take what clients reported that they were smokers and then lay this out on something called a GIS map, where it will tell you by zip code how many clients are coming from a certain zip code or certain area. So this GIS map or GIS tool is one of the county GIS. We take that and integrate that into the system, then look up all the clients who have a certain diagnosis, which is a smoking diagnosis, and overlay this on the GIS map. So now I know from what areas of the county or what the neighboring counties where I have clients coming from, where is a large percentage of population who are smokers. Accordingly, I can set up my community outreach program. Once I have all this data, I can use it even further if I can do certain analysis by seeing what kind of services or programs do I have where I'm seeing large amount of smokers. Am I seeing a lot of clients who are smokers who are in family planning services, or they are in pregnancy services, or they are diabetic, or I'm seeing them in my medical nutrition clinic? So by looking at where my smokers are coming into my organization and which service they are getting, accordingly, I can plan for the future of where do I want to make this intervention of providing smoking cessation counseling, and accordingly train my staff to provide the cessation counseling services while they are providing, say, the family planning service, or they're providing a diabetes nutrition service. At the same time, I can also run reports to see my smokers, what other problems do they have? Do they have asthma? Do they have obesity? Are they diabetic? So by looking this across various conditions, now I can also do other planning of do I want to treat them for their other conditions together, so that this way I can plan on what kind of staff would I like to have if I want to have introduced more services into my organization. And finally, about insurance reimbursement. We all do want to get paid for our activities. So insurance reimbursement is available for smoking cessation counseling. Users, they should be able to check for insurance eligibility from the EHR. So again, coming back to EHRs, what features you would like to get in the EHRs. One of the important features is to check if they are eligible to receive smoking cessation, as in is the insurance going to pay for this. Many EHRs have clearinghouses to which you can actually connect to maybe 2,000 plus payers, and you can run the eligibility check directly from the system. Whether you're running it for Medicaid or Blue Cross or Aetna or Cigna, by having this integrated into the EHR, it avoids you having to go to another portal key in the patient name all over again, key in their maybe patient ID, and then look up the eligibility information. If it's integrated into the EHR, it really speeds up the process of the check-in staff. About what service codes, I have listed some sample service codes which are common across the private Medicaid or Medicare providers, and their the reimbursement rates, some sample reimbursement rates we've seen in several different states. So one way you could help your clinicians is provide them a cheat sheet of these are the common service codes, or you could have clinical decision support rules set up in your system. If you did provide, say, 5-ways counseling, then this service code should automatically be populated into your clinical note. And finally, this is my favorite slide. So what is the future? There is a lot more that we can do, just not EHR related, which is within your clinical workflow. There's other things that the EHR can connect to, which is directly into the patient's life. So for example, there is a device out there which is called Fitbit. It has a sensor, it is a lighter, and it has a sensor to which the EHR can connect to. So every time they open that lighter and light it up, it will send a message back to the EHR that or it will actually record that information, and next time when the client comes in, you can download that information into the EHR, and you can see how many times did they actually light up that cigarette lighter. So you get daily living data of how they are doing on their smoking cessation. There are other devices which are available, which are not available actually right now, but they are still at the university research level, where there are monitors, which they are monitoring the client environment to check if there was any lapse in cessation. So those monitors can be mounted on the patient's bodies, and as it's continuously monitoring the environment to see if they are smoking at the moment, and when next time when the client comes in, you can download that data into the EHR. The last thing that is also in research right now is to create predictive models for smokers. So this is all big data analysis, where you can take this information of smokers across the country and create models or profiles for every smoker to identify, okay, what kind of patient is this based on their past behavior or their ethnicity or their demographics or where they come from. And based on these profiles, the system can actually prompt the clinician of what kind of treatment is going to be effective for the client that they are currently serving. If you would like to have get more resources or more information about the topic that we just discussed, we have these resources listed on the link on the website on my slide right now. Some of the information directly comes from the lung organization, and some information is directly from the CDC website. That's all I had to present today. Thank you for giving us the opportunity to present. We enjoyed putting this presentation together and share with you what our technology can do. If you have any questions, please feel free to contact us via email or at the number listed above.
Thank you, Sonali. If anybody has any questions, feel free to put those in the questions box now. We'll hang out for a few more minutes here while people type questions. And thank you very much for attending. Okay. Well, I don't see any questions coming in. On March 6th, we will be presenting our next webinar on EHR and Beyond the EHR, Connections That Count, presented by Tom Power. We'll be sending out some more information about that soon. This webinar has been recorded, and we will be having that upload onto the GoToWebinar site as well. So if you need to see the recording or want to share that with somebody else in your organization, you can feel free to do that by registering again at the link, and you'll get the recording that way. So I guess if there's no further questions, just check the chat box. Yeah, okay. Well, thank you everybody for attending, and we will hopefully see you next time.
Thank you. Bye-bye.